facial aging is loss of volume. That's been one of the big new paradigms in the past 10 years. There's a lot of options for patients that are quite confusing. They can fill their face with fillers. Fat has become very popular. Bruce, how do we sort it all out?
Well, you know, it is a little confusing, and understandably so for patients. Fillers have been around for a while, and they work. I mean, there's no question. People can come in over a lunchtime, have these injections, restore volume, and we have newer and more versatile fillers than we've ever had. Now, there are variations in these. How long do they last? There are some that are billed as permanent fillers. And in some cases, we have some concerns about what's the long-term effects of injecting this stuff, you know, into the soft tissues. Then you look at fat. And I will tell you, in my practice, I've really made a conversion, and I really do encourage and push patients towards fat. It's natural. You know, I mean, it's the ultimate recycling, right? We're taking it from somewhere you don't want it and putting it where you can use it. But there's other benefits too. The fat contains stem cells, and those stem cells secrete growth factors when we inject this fat. And also fat is really, I would say, probably more of a permanent long-term fix.
You know, Bruce, I couldn't agree with you more about fat, but I would like to point out that I think fillers and fat do very different things. You can inject the dermal filler into the dermis, and that oftentimes, especially in my climate, you see people who have very dehydrated skin that has lost a lot of collagen, and actually injecting it into the skin itself changes the consistency of it. Secondly, some of the lines are etched into the skin itself rather into the deeper tissues. So I use the fat to volumize the deeper areas where there's been skeletal loss, fat loss, muscle loss, but then the filler to increase the wrinkles, the folds, the cracks, if you will, in the skin. And they're also able to see what that looks like. So maybe oftentimes the filler acts as a bridge to when we might use a little fat in the operating room. One of the points I want to make, though, is that we see a lot of people that are getting fillers in strange places by strange people, and they have no idea what it is. So I think it's an important conversation. Is it going to be fat, or is it going to be a filler? What kind of filler it is, and also who's injecting it?
You know, that's a really good point, because some of the people that are doing fillers can't do what we do as board-certified plastic surgeons and offer them the alternative of fat.
And even though it's not surgery, you can have surgical type complications if it's not done well.
Get a board-certified plastic surgeon who does a lot of these types of procedures, and don't trust yourself to a deal.
You can see more of this on theplasticsurgerychannel.com.